How is everyone doing? How are you doing? How are you doing? For today, we are going to go through approach to hyperthyroidism. Everything you need to know about hyperthyroidism. Okay. So, this preparing for the NCLEX is all about mindset. It's all about having the right mindset in order to be able to, get into to grab the concepts, right? So the first thing we have to learn, the first thing we have to know is that thyroid disorders, the thyroid hormone and its effects can be seen in many organs. That's the first thing you need to note. Okay, the effect of the thyroid gland can be seen in many organs. So the first thing we need to know, Dr. Ngozi and everyone on the line right now, is that the thyroid hormones, which are produced by the thyroid gland, it increases the basal metabolic rate. When we say it increases the basal metabolic rate, in other words, it causes a lot of functions in the body to move up. I want to just put it in that simple term. So when we say it increases basal metabolic rate, for example, it increases oxygen consumption. All right. And as we go through all its functions, you will realize that we are going to use those functions to then help us to know if there's an abnormality and if the thyroid gland is hyperfunctioning or hypofunctioning. Okay, so it increases respiration as well. And then it also causes heat generation. And it leads to increased cardiovascular activity. So even before we move deep into it, you realize that if the thyroid gland and the hormone it produces affects all these things, therefore, if the thyroid gland is overacting or working too much, then you are expecting an increase in respiration, you are expecting an increase in heat production and heat generation, you are expecting an increase in cardiovascular activity. Please, are you following me so far? Because I want to take my time and build the thoughts gradually. So since it increases basal metabolic function, okay, it's going to increase cardiovascular activity. It's going to increase heat generation if it is overacting. So what I want you to do is that when we are thinking about, okay, these are the things which can happen with the thyroid gland, then you have to ask yourself, what about if the thyroid gland is overacting or underacting? So if it's overacting, you will see that the cardiovascular activity will be high, heat generation will be high. But if it's underacting, then heat generation will be low, right? Okay, so let's continue. At higher levels, okay, thyroid hormones can potentiate the actions of growth hormone and catecholamines like epinephrine. And epinephrine is, that's flight or fight hormone. So assuming a lion comes into the room right now, what will cause me to run without even thinking? It is the epinephrine. And the thyroid gland is able to support the action of these hormones and these catecholamines. So another thing is that if the thyroid hormone is overacting, the body will behave as if it is starving. And I'm going to show you how that was presented in our preparation for the NCLEX, how we should approach it. So the thyroid hormones are needed for normal growth of the fetus in the uterus and even when the child is born. It is also needed for brain development. Please write it down. It is needed for brain development. It is needed for growth of the fetus. Okay? Now, so you realize that the thyroid gland can affect all these things. So I have a question. If the thyroid gland affects normal growth of the fetus and the child, assuming the thyroid gland is not working well, what do you expect to happen in the growth of that child? Does anyone want to contribute anything? You don't mind, you can just unmute yourself and let's have a conversation. We said that the thyroid gland is needed for normal growth of the fetus and brain development of the child who is born. Assuming that thyroid gland is not acting well and it is underacting, what are we expecting? Can somebody help me?
It can lead to intrauterine growth retardation.
Okay, it can lead to intrauterine growth retardation. What else? What else? If it is needed for brain development and it is not working well, what will happen to the brain of the child?
Neurodevelopmental disorders.
Exactly, there can be developmental disorders as well. So thank you very, very much. That's awesome. So think about what can happen to a child if the thyroid gland is not working properly. Okay, so because that is where the issues can come from. Okay, so now let's start with the thyroid system itself. I want you to write these things down. Hypothalamus, anterior pituitary gland, and the thyroid gland. I want you to write these three things down. HPT, hypothalamus, anterior pituitary, and thyroid gland. I'm going to write it on the screen for you. Hypothalamus, HP. Hypothalamus, anterior pituitary, HPT, and the thyroid gland. HPT. So I don't know what is happening to my handwriting, but HPT. Because you need to understand this. HPT. Hypothalamus, anterior pituitary, and the thyroid gland. And we are going to learn the relationship these three should have. So let's start with the hypothalamus. In the hypothalamus, a particular hormone is produced. We call that thyrotropin releasing hormone, TRH. So hypothalamus goes with TRH. Please write it down. Hypothalamus goes with TRH. Hypothalamus goes with TRH. So they don't forget it. And then the pituitary, the anterior pituitary, produces TSH. We are taking it one by one. Hypothalamus produces TRH. Anterior pituitary produces TSH. And then the thyroid gland produces T3 and T4. But I'm going to share something with you. So hypothalamus. So can somebody summarize for me? I really want somebody to summarize for me. Hypothalamus, anterior pituitary, and thyroid gland. What is produced by each of them? Can somebody summarize for me, please? I need a volunteer. What hormone is produced by each of them? Hypothalamus, pituitary, and thyroid gland. Hello, who help us?
I think low level of T3 and T4.
No. Just tell me which hormone is produced by what. That's all.
Hypothalamus. Hypothalamus produces thyrotropin releasing hormone.
TRH. Beautiful.
And then the anterior pituitary gland produces thyroid stimulating hormone.
TSH. Okay.
And then the thyroid gland produces T3 and T4.
Exactly. Now, you realize that so hypothalamus, anterior pituitary, thyroid. Now, when the free T3 and the free T4 are produced by the thyroid gland, at times they can go back and have an effect on the pituitary and the hypothalamus. So, for example, if the body is getting too much T3 and T4, what the body will do is that same T3 and T4 is going to send what we call a negative feedback. negative feedback. It will send a negative feedback to the hypothalamus and the pituitary gland that, hey, we have too much of T3 and T4, so slow down. Okay, so we need hypothalamus to produce TRH, and then that is going to stimulate the anterior pituitary to produce TSH, and then that is going to stimulate the thyroid gland to produce T3 and T4. Please, can I proceed? Because a lot of us said we've not reviewed this topic. That's why I'm slowing down. Can I proceed? Hypothalamus, anterior pituitary, and thyroid gland. Please, can I proceed?
Yes.
Okay, beautiful. Good. And then I said that if there's too much T3 and T4, they send a negative feedback, okay, to the hypothalamus and the pituitary that, hey, slow down the production of TRH and TSH so that the body does not get overstimulated by T3 and T4. So the body has what we call a negative feedback reaction. Okay, good. Now, the thyroid gland is stimulated by TSH and other hormones. That's what we've said. Thyroid gland secretes T4. Okay, so that's what we've already said. 80% of T4 is converted to free T3 in the peripheries. Okay, and T3 negatively feeds back to the anterior pituitary. So it's the same thing. Let me say it again. This diagram is very, very important. We'll be reviewing some important concepts at the end of the class. You should know this diagram in order to be able to grasp it. Hypothalamus goes with TRH, anterior pituitary goes with TSH, thyroid gland will release mainly T4, and the T4 is converted to T3 in the periphery. Okay, let's go on. So let's now focus on hyperthyroidism. That is overaction of the thyroid gland. Hyperthyroidism. Now, hyperthyroidism, there are so many tricks and things to it, but we're going to keep it very simple. Hyperthyroidism is as a result of excessive secretion of thyroid hormone. Let me say it again. Excessive secretion of thyroid hormone. Hyperthyroidism. Hyperthyroidism. Excessive secretion of thyroid hormone. Okay. Now, remember that we said that the thyroid gland and its effect can affect so many parts of the body. So, because we said that in hyperthyroidism, the thyroid is overfunctioning, there's oversecretion of thyroid hormone. So, number one, you realize that there will be weight loss. Please write it down. It leads to weight loss. Number two, remember that we said that the thyroid hormones are also responsible for heat production, like the basal metabolic. So if the thyroid gland is overworking and there's oversecretion of thyroid hormones, that means that the person will produce so much heat, so the person cannot stand it. We call that heat intolerance. And then there will be increased cardiovascular function. And so if the heart is overfunctioning, at times it can lead to palpitations. That is, the heart is beating fast. And then it also affects the gastrointestinal system. And you know that when we eat, food goes through the gastrointestinal system. So if the gastrointestinal system is also affected, then what is going to happen is that the patient is going to feel very hungry all the time. And the patient may also have some form of diarrhea because the gastrointestinal system has been stimulated. And there can also be increased neuromuscular function. Please, I want to make sure we grasp this slide very well. Sorry, I have a little cold. I want to make sure that we've grasped this slide very well. Please, is it clear? Is it self-explanatory? When the thyroid gland is overworking, it can lead to weight loss, it can lead to heat intolerance, it can lead to palpitations or excessive heart beating, it can lead to excessive hunger, it can lead to diarrhea, and it can lead to increased muscular function. Please, can I move on?
Yes.
Good. So now, this is a memory trick. Please write this down. How can I remember the effects of hyperthyroidism? The effect of hyperthyroidism. How can I remember that? So this is a memory aid I want to give you. Because in the exam, you need things which will help you to remember. So if you write thyroidism, we are looking at the effects of hyperthyroidism. Number one, it can lead to tremors, shaking of the hand, tremors, thyroidism. Number two, the H stands for heart rate to be up, palpitations, heart rate to be up. Then the Y will stand for yawning. The client will be yawning. They'll be fatigued because the body is overworking. Oh, I don't know what to do. Yawning. And then the R will be for restlessness. Restlessness. And the O will be for oligomenorrhea. That is decreased menstrual flow. So if the patient is menstruating, there will be decreased menstrual flow or amenorrhea. And the I stands for intolerance to heat. Intolerance to heat. So that's what I was saying. The patient will not be able. So we are looking at how to remember the features of hyperthyroidism. And the acronym we use will be thyroidism. Okay? And D stands for diarrhea. Diarrhea. Because, the gastrointestinal tract will be overstimulated. Diarrhea. And then I will be irritability. Because, the person has excessive heat production. The heart is beating fast. The person is anxious. So the person is always irritable. Irritability. And the patient will also sweat a lot. Sweating. That is what the S stands for. And the M stands for muscle wasting or weight loss. So today you've learned how you are going to remember the effects of hyperthyroidism on the body. Thyroidism, tremors, heart rate will be up, yawning, restlessness, oligomenorrhea or decreased menstruation, intolerance to heat, diarrhea, irritability, sweating, and muscle wasting or weight loss. Okay? Muscle wasting or weight loss.